Here's a simple diagram of your menstrual cycle and where the phases are located and where ovulation is. So if we're using a 30-day cycle, because 28 is used far too commonly, 30 days of the menstrual cycle, that means your period is going to start on day 31, and our other period is here. So this is the first day of our period, which is the first day of the full bleed. You may have had a day or two of spotting before then, but day one is full bleed, not spotting. So let's say that our period is 5 days. So we're predetermining that the cycle is going to be 30 days. So when I plot ovulation on here, it's going to be roughly 12 to 14 days prior to your period. So if we're using a 14-day cycle, that means ovulation would be on day 16, and we'd have a luteal phase of 14 days. Now this would be ovulation, the cycle's main event. And then from day 1 up until here, we had our follicular phase. And then once we get to the end, we have our period. We're gonna do the whole cycle all over again. Now, your cycle's not gonna be super consistent every single time. It's pretty normal for it to fluctuate a little bit here and there, or maybe every once in a while you'll have an irregular cycle due to stress, or maybe you got sick. That's okay. But if your cycles are like very irregular and it's always fluctuating, or you're missing a period, that's something to look into. And remember, when you are using an app to chart your period, just make sure you're not following the exact day that tells you that you're going to ovulate, because you might ovulate either sooner or later than your app is telling you. If you want to learn how to use a fertility awareness method so you can either prevent pregnancy or plan a pregnancy naturally, we basically use our daily fertile signs to determine whether we are fertile for that day or not. So you can figure out where your fertile window is. So this person would have their fertile window like right here before ovulation. And then once we use our biomarkers to confirm the ovulation has took place, we wait 3 days, and then for the rest of the cycle, you can't get pregnant. So you're pretty well good to go. But before you do that, you have to either learn from an instructor, you have to take a course. Just make sure that you're actually using the method correctly, because a lot of people are using this more in like the rhythm sense, and then they accidentally get pregnant.